Hi, I'm Dr. Behnam. I'm a board-certified dermatologist in Los Angeles, California, and I specialize in PRPs and stem cell hair restoration. And I'm Dr. Sean Behnam, Dr. Ben's twin brother, and I'm a hair restoration specialist. I do all the hair transplants and FUE in our office. Yeah, and we both work in the same office. And today, this is another video for stem cell hair restoration for one of my patients. And actually, I'm very excited to show this patient because he is an older gentleman who had done multiple hair transplants. He's in his 70s, and
I did not do the transplant.
Yeah, we did not do a transplant. It was somebody else. He had done it back years ago, and he's not a candidate for another hair transplant. And this area really bothered him, Dr. Sean. Really bothered him. But he is not a hair transplant. He's older. He didn't have really like a lot of hairs from the back. His donor side was very weak. So, and he's already been on oral finasteride for over a decade. So he wanted another option. So we decided to do stem cell on him.
Right.
So this is him, and this is him about 4.5, 5 months later. So you could tell that, that a lot of the hairs in this area, we did really this area, a lot of hair grew out. And look at the hairs in the front.
Pretty surprising because in the before photos we see a lot of actually scarring and really no even miniaturization, but amazingly some of these have actually grown out. It looks really good.
Yeah, so again, this was a patient. The reason why I'm excited about it is two things. One, he is in 70s, and number two, you're right, he didn't seem to have like a lot of hair growth. He was not the best ideal candidate for stem cell either, and I told him that it may not grow out, but as you know, results does vary amongst everyone, but he did really well and he's actually very happy. He did continue taking his oral finasteride, so the results of the stem cell could last a year to a year and a half, depending on him.
Perfect. And obviously people always ask stem cells. There's the stem cells that come from, the abdominal fat, stem cells that come from the bone marrow, these stem cells are fetal stem cells that come from babies. So what's the difference and why is it that in this case, right, and in every case use fetal stem cells, and why is it so important?
So using umbilical cord stem cell, in my opinion, is superior to your own stem cell because they're just fresh newborn stem cells.
Right.
And I think they do a much better job. There are studies that basically, I think, compare umbilical cord to your own stem cell and they realize that your own stem cells are old, they're not as good. So in him, we use the umbilical cord stem cell, 30 million cell. We also mixed it with a high volume PRP. We numbed him and we literally did hundreds of injections in that area, and this is him about 4 or 5 months later. So he's doing very well.
Wonderful. And obviously one owns fat stem cells, if he's 7 years old, those are also aged, right? So
yes,
it was something fresh, from umbilical cord baby, and that's actually very important.
Perfect. And all those stem cells come from a very reliable company and they all get tested. So, and we always have the test results to show our patients. So, and the better quality stem cells we get, obviously they're more expensive, but the better result patients typically tend to have.
Perfect.